Perfect. All right. So, Kent, how are you?
Fantastic. How are you doing, Mary?
Really good. So, Kent, I wanted to bring in different professionals to talk about different aspects of health. And I wanted to give you this platform. I've seen you, I've known your patients, and I trust you. That's important for me to have you on my page only if I trust you and I believe what you do.
Thank you for that. Trust is important for sure.
Definitely, definitely. Especially when it's something that we don't really, the patient doesn't really understand, right?
Quite often, yeah, we find don't understand the depth of it. Maybe just a fine little overlying understanding of chiropractic, but not the depth of it.
Right.
Yeah.
So what would you like to discuss on this platform?
I think I could talk for probably 2 days on chiropractic and what it is and what it does. I think something that I want to bring up that's going to be super important for people to hear is why you should get your spine checked for one, and then basically just the push to get it checked regardless of if you're going to get treatment or not. And I know you can attest to that, and we'll get into that, I'm sure. But the importance of getting your spine checked for, and people say checked, what does that mean? Checked for early degenerative patterns for one, checked for any neurospinal interference, and then check for any kind of alignment postural issues that can then lead to degenerative patterns. Because as again, you're going to mention, but the earlier you catch that, the sooner that you can get that corrected and not have some kind of issue show up down the line. So I think that's one of the biggest keys to this, is that just getting it checked. And I like to use the analogy like going to see a dentist. You want to go at least, well, they say 6 months, you want to go get your teeth checked to make sure there's no cavities, make sure they're not falling out of your mouth, because you kind of need those. But the nice thing about going to get your teeth checked is you can kind of see them. You can look in the mirror, you can kind of look, you don't know exactly what's going on, but you can see if they're crooked, you can see if they're starting to rot away, going yellow, and then you know. With your spine, it's internal, and many times people don't know there's an issue until it's too late to make that full correction.
I'll share that part of that too.
Yeah, so why don't you go ahead and tell everyone your story and maybe why you brought me on.
All right, for sure. So for me, I never saw a chiropractor. I was always scared of seeing a chiropractor. I didn't want my neck snapped, all the big everybody's scared of. And I went camping one year, and I didn't have my really great pillow that supports my neck really well. I've always had kind of headaches and stuff, no big deal. But this one pillow I needed, and my arm started to ache. And it started in my back, right around here, but in my back. And throughout the week, by the time I got back, my arm was asleep. The pins and needles, oh my gosh, this hurts so much. You want to hit it to wake it up.
Yeah.
But that's going to hurt. So I went because I still had the ache as well. I thought it was just a tight muscle in the back. So I booked in massages, and I had 2 or 3 massages a week for a month, so 4 weeks. And I had heard somewhere that if you have your pinched nerve for 6 weeks, you could be looking at permanent damage. This is just what I heard. So at 4 weeks, I got a little nervous, and I went into my doctor, and I told him what's happening. And I was moaning. I was at work moaning all the time. And he sent me to physiotherapy. Physiotherapy put me in traction. They did a bunch of stuff. They taped up my shoulder and said, have better posture. You should know better. And which is great. I mean, that's what they understood, and that's what they knew. No one has taken x-rays at all yet. And I went to him for 2 months, 2 or 3 times a week. This costs a lot of money, a lot of time, and it's a lot of pain. And then I had, sorry?
Time and energy and effort, and yeah, for sure.
Yeah. So then I met this one individual. He was a client where I was working, and he was just sitting down, casually waiting, and I started up a conversation, and he said, you need to come see me. I wasn't crying, but it was coming down my face. It's now 3 months, and I'm moaning at work all day. And so I went in to see him. He's the only one that took x-rays, right? He did a balance check, and my third visit, he woke up my arm. And it's still emotional now because it was so bad. It was so bad. At that point, they said not to carry a purse. So I have a little wallet that I carry. I'm not allowed a purse, maxed out at 10 pounds. And so I have a bulging disc. For simplicity's sake, I tell people I have a spinal injury, which is true. So I have bulging disc that was pinching on the nerve, and then is it splinters? You have the little pieces that come out.
Spurring.
Spur, thank you. Yeah, so if it wasn't for, one more really important thing, and a major point of why I wanted you here. They said that I had this for about 20 years before they found it. So now I'm in stage 4, which means they can't really correct me. Had I been in even 5 years before, they would have been able to help me. If I was in 10 years before, absolutely they would have helped me. And I wouldn't have known it. I wouldn't have had the pain or anything. So it's like you were saying, something that you don't know.
Exactly.
You can't see it. And had I been earlier, I wouldn't have my spinal injury.
Yeah.
I'm definitely a purport. Sorry?
Powerful message for people.
Definitely. I definitely support getting checked out, getting the alignment checked out, find out what's going on beforehand. I know that there's a bunch of other aspects of chiropractic care, but that's what happened with me.
And you're not alone in that. There's so many people. It's interesting that we're on this call. We finally lined it up after trying to set it up for a couple of weeks. And I was in work this morning, and I saw a close family member of ours. And I got a text from my uncle, and he said, you know what, my wife's in tears. She's got tingling, pain down her arm. She's had it for so long. She just can't handle it anymore. Is there any way you can see her? And she came in. And very much like your story, it's basically a mirror to your story. And this is a regular occurrence at the office, and that's why I just emphasize, go get your spine checked, right? Because you don't know. You could sometimes, and it's interesting, so when you talk about the phases of degeneration, so people know there's normal, phase 1, 2, 3, 4. Once you hit 4, there starts to be fusion in the spine, and then you lose that motion. Anything from phase 3 back, you can actually correct. You can stop it. You can't get rid of any of the spurring that you talked about, any extra bone growth, but you can actually stop that degenerative pattern and start to slowly reverse it with the right treatment. So catching it earlier is so, so important. So it's hard to see when people are that far along the line. And what I was getting to is that sometimes I see people that are asymptomatic, nothing going on. They just come in to get their spine checked, which is awesome. But sometimes they're asymptomatic and they're phase 3, almost phase 4. Sometimes there's people who are extremely symptomatic, headaches, dizziness, tingling, pins and needles in their hand, and they're back in phase 1. So everyone's body responds differently. And that's why just because you don't have pain and symptoms doesn't mean that you're functioning at 100%. You could have some kind of disease process building in the body. And if you think about one of the biggest things right now out in the world, cancer, do people catch it usually early or usually when it's really progressed and all of a sudden causes issues, right? So it's about maintenance. Our society is very reactive instead of being proactive and taking care of our bodies beforehand, which now you're in the health world and you know people need help when it comes to being proactive about their health instead of reactive. Yeah. So this is just another one of those things. So being proactive about what you eat, being proactive about how you treat your body and exercise, being proactive about getting your teeth checked, and people don't realize about being proactive about getting your spine and nervous system checked. Because getting arthritic changes in the spine is really no different than getting arthritic changes in the knee. It's some kind of alignment function issue that over time it starts to break down. So imagine your knee joint, it's just shifted and years and years and years, and it starts to go, and then you have bone on bone. The nice thing about that is you can go in, they cut your knee and they replace it. With your spine, unfortunately, you can't just go in there and chop it out and put a new artificial spine in place. It is what it is, and you just have to maintain it from there. And your spine holds your nervous system that controls the function of your whole body, and it's an integral part in this. The spine actually plays an integral part in brain function as well, which a lot of people don't realize that either. And that's a whole nother avenue that I was saying I could talk for 2 days about. But the signals that come up from in your spinal cord will go to your brain, but they're saying roughly 70% or more of the signals to your brain come from the spine, not through the spine. So just having proper motion in those spinal joints and keeping the integrity of that motion and the function of that spine going, actually you're improving 70% of the signals to your brain. So the research is showing improvement in cerebellum function, prefrontal cortex, which prefrontal cortex in your brain is activated after treating and restoring proper motion in the spine. And the prefrontal cortex is involved with decision making, behavior, problem solving. So indirectly, you can affect that part of your brain and potentially have a greater effect on the whole system. So we could talk about that forever, but again, it just shows the importance of the spine and how keeping it healthy and getting it checked regularly is just so, so important.
I'm going to add, when I go in and I get my adjustments, I sleep better.
That's usually what we tell people after the first adjustment. Even if you don't have pain relief right away, a lot of times the first 2 things we notice are increased sleep, increased energy. That's just what people come back saying. It's not like we're treating your energy or your sleep problems. We're treating the nervous system. And if we can get it into a more calm state and functioning better, then we're overall more relaxed. So that's awesome that you said that. I'm glad you noticed that, because a lot of people will come back and say, wow, I just slept amazing. Especially young, newborns or young kids. If they're having trouble sleeping, lots of times the adjustment can help with that. Now we're not curing any disease. We're not treating that. We're just treating the spine and the nervous system so that your body can function properly.
Well, this is a great side effect.
Side effects are sometimes good.
Yes. That's good. That's good. Is there anything else that you wanted to touch on while we're here?
I think that was the biggest points. Yeah, I think just knowing that you can have something going on and not know it is kind of the biggest takeaway. Right? And you're a testament to that. Just getting regularly checked on all aspects of life and health, whatever it might be, whether it be blood test or get a functional test to see if you're moving properly or your muscles are working properly, whatever it might be. Just make sure you're taking care of your body and getting everything checked regularly.
Yeah, before you realize that there's a problem.
Exactly. Yes. We don't want to wait.
No, because when you realize that there's a problem, it's usually, it's been there for a while.
For sure. Typically, yeah. Any kind of sickness is not a snap of the fingers. You don't have it one day and you have it the next day. A lot of people will come in and say, oh, I just kind of tweaked my back. Well, maybe it was the straw that broke the camel's back and it was kind of building for how many years, or maybe you had some kind of big car accident and didn't know you had an injury, but now 20 years later, now you tweaked your back, which probably just was that last straw. So imagine if you got it checked back when you had that accident, and then there'd be no straw to break the camel's back.
That's right. Agree. Great. And I'm going to, underneath the video, I'm going to post in how people can get a hold of you, unless you'd like to tell them now.
Yeah, there's a number of ways. Best way would just be to either text or call our office. 250-868-4880 is our office number. You can jump on our website, lifeworkschiropractic.ca. is a good way. You can get more information about what we do, where we're located, and then you can, we're going to soon have online booking on there. It's in the works. But for now, we'll just call or text the phone, and then there's intake forms online. You can also follow me. My personal Instagram is at Dr. Kent Rempel. I post more stuff related to running and fitness on there, a little bit of chiropractic stuff. And then one thing I did want to mention as well is we do weekly talks in the office. So if you want more information about what is chiropractic and what's it actually doing, more information about how it activates the brain, all that kind of stuff we'll touch on in the office once a week. So they run alternating Mondays and Tuesdays. If you want information on that or you want to come to one of those talks, it's free. You can come just hang out. Right now, we used to bring in food, but right now we're not just because of everything. And then spots are obviously limited right now. But alternating Mondays and Tuesdays, either myself or one of the other doctors in the office will be doing those talks. So they're fun. We can hang out and just learn some more about how to stay healthy, how to keep your spine healthy, since now we know how important it is.
Well, yeah, had someone told me, I would have been in so much sooner, so much sooner. Kent, I've seen you do some presentations and talk about chiropractic care, and you're passionate about it, and I love that. You're very knowledgeable. I love that too. And I think that's another reason why I chose you. I wanted to work with you. And I thank you so much for giving me this time.
Thank you for sharing your story too and bringing me on. I feel honored to be the chiropractor who you wanted to bring on. So thank you so much.
Definitely. Thank
Awesome.
you. All right.